In vitro fertilization, or IVF, is a remarkable medical process. It helps many people who have trouble getting pregnant. Think of it as giving nature a helping hand. The term in vitro means in glass. This is because the fertilization part, where the egg and sperm meet, happens in a special dish in a laboratory. It does not happen inside the body. The main goal of IVF is to create a healthy embryo. This embryo is then placed into the uterus with the hope that it will lead to a successful pregnancy. This technology has brought joy to millions of families around the world, offering a path to parenthood when other methods have not worked. Your IVF journey begins with a very important first meeting. This is the initial consultation with a fertility specialist. During this visit, you will talk a lot with your doctor. They will want to understand your medical history. They will also want to know about your partner's history if you have one. This is a time for you to ask all your questions. No question is too small or silly. The doctor is there to give you clear information. They will explain what IVF is and if it is the right choice for you. This first conversation is the foundation for your entire treatment plan. After the initial talk, the doctor will need to do some tests. This is the evaluation phase. It is like gathering all the puzzle pieces before you start putting them together. For the person who will carry the baby, this often means blood tests and an ultrasound. The blood tests check hormone levels, which are important for pregnancy. The ultrasound lets the doctor look at the ovaries and uterus to make sure they are healthy. For the person providing sperm, a semen analysis is usually done. This test checks the number, shape, and movement of the sperm. All this information helps the doctor create a personalized plan just for you. This initial stage is all about gathering information and making a plan. It can feel like a lot to take in. There are many new words and concepts to learn, but remember, your medical team is there to guide you. They will break down the complex parts into simple, understandable steps. It is important to feel comfortable and supported from the very beginning. This evaluation ensures that the IVF process is tailored specifically to your body's needs. It maximizes your chances of success and makes sure the procedure is as safe as possible for you. The goal is to build a strong, clear path forward on your journey to having a baby. Once your personalized plan is ready, the next stage begins. This is called ovarian stimulation. The goal is to help your ovaries produce multiple mature eggs in one cycle, instead of the usual single egg. To do this, you will be prescribed special medications. These are fertility hormones, and they are usually given as injections that you can administer at home. Your doctor or nurse will show you exactly how to do this. It might seem scary at first, but it quickly becomes a routine part of your day. These hormones are a key part of the process, as having more eggs increases the chances of creating several healthy embryos. During this hormone treatment phase, you will visit the clinic regularly. This is for monitoring. The doctors need to watch closely how your body is responding to the medication. They will use two main tools for this. Media group, close-up of blood draw in clinic, transvaginal ultrasound procedure in medical setting, at stock, at distribute _equally, blood tests, and transvaginal ultrasounds. The blood tests measure your hormone levels to see if they are in the right range. The ultrasounds allow the doctor to see the follicles in your ovaries. Follicles are small, fluid-filled sacs where the eggs grow. The doctor will count and measure these follicles to track their development. This careful monitoring helps determine the perfect time for the next step. When the ultrasounds and blood tests show that your eggs are mature, it is time for the trigger shot. This is a final hormone injection that prepares the eggs for ovulation. It is very important to take this shot at a very specific time. Your clinic will give you precise instructions. About 34 to 36 hours after this trigger shot, the egg retrieval procedure is scheduled. This timing is critical. It ensures that the eggs are collected at the peak of their maturity, just before your body would naturally release them. This precision is what makes the retrieval successful. The egg retrieval is a minor surgical procedure. It is done at the fertility clinic or a hospital. You will be given a light anesthetic or sedation so you will not feel any pain and will be comfortable. The doctor uses an ultrasound to guide a very thin needle through the vaginal wall and into each ovary. The needle is attached to a suction device that gently draws the fluid in the egg from each mature follicle. The whole procedure is quite quick, usually taking only about 20 to 30 minutes. Afterward, you will rest for a little while at the clinic before you can go home. It is normal to feel some cramping or light spotting, but this usually goes away quickly. As soon as the eggs are retrieved from your body, the science in the laboratory begins. The fluid collected from the follicles is immediately taken to the embryology lab. An embryologist, a highly trained scientist, will carefully examine the fluid under a microscope. Their job is to find every single egg. Each egg is then placed in a special culture dish. This dish contains a nutrient-rich liquid that mimics the environment inside the body. The eggs are kept in an incubator, which is a special machine that maintains the perfect temperature and conditions for their survival, while the sperm sample is prepared. On the same day as the egg retrieval, a sperm sample is also collected. The lab then prepares this sample through a process called sperm washing. This process separates the healthiest, most active sperm from the seminal fluid and other cells. Once the best sperm have been isolated, the fertilization process can begin. There are two main ways this is done. The first method is conventional insemination. In this method, the eggs and a large number of sperm are placed together in the culture dish. The hope is that a sperm will naturally fertilize an egg on its own overnight. Sometimes, there might be issues with the sperm that make natural fertilization difficult. In these cases, a different technique is used. It is called intracytoplasmic sperm injection, or ICSI. This is a more direct method. The embryologist uses a powerful microscope and a tiny hollow needle to pick up a single healthy sperm. They then carefully inject this single sperm directly into the center of a mature egg. ICSI is very helpful when sperm count is low or the sperm have trouble moving. It bypasses any potential barriers and greatly increases the chance of fertilization. Over the next few days, the embryology team watches the fertilized eggs very closely. They are looking for signs of cell division, which means an embryo is starting to grow. A fertilized egg becomes a 2-cell embryo, then a 4-cell embryo, and so on. The embryologists check on them daily, monitoring their growth and quality. They grade the embryos based on their appearance to determine which ones are the healthiest and have the best chance of developing into a successful pregnancy. This careful observation period, which usually lasts about 3 to 5 days, is crucial for selecting the best embryo for the next and final step. After 3 to 5 days of careful growth in the lab, it is time for the embryo transfer. This is the moment a healthy embryo is placed into the uterus. This procedure is much simpler than the egg retrieval and usually does not require any anesthesia. It feels very similar to a pap smear. The doctor will use a speculum to see the cervix. Then, a very thin, soft tube called a catheter is loaded with one or more selected embryos. The doctor gently guides this catheter through the cervix and into the uterus. Once in place, the embryos are carefully deposited. It is a quick and painless process for most people. After the embryo transfer, you will be asked to rest for a short period at the clinic. Then you can go home. The next 2 weeks are often called the 2-week wait. This is the time between the transfer and when you can take a pregnancy test. It can be a very emotional and anxious time filled with hope and uncertainty. Your clinic will advise you to continue taking hormone medications, usually progesterone. This hormone helps to support the uterine lining, making it a welcoming environment for the embryo to implant and grow. During this time, it is generally recommended to avoid strenuous activities, but you can usually continue with your normal daily life. About 9 to 14 days after the transfer, you will go back to the clinic for a blood test. This test measures the level of a hormone called HCG, or human chorionic gonadotropin. This is the pregnancy hormone, and its presence in your blood is the first official confirmation of a successful pregnancy. If the test is positive, your doctor will schedule follow-up blood tests and eventually an ultrasound to confirm the pregnancy is progressing healthily. This first positive test is a monumental milestone in the IVF journey, but it is just the beginning of the next chapter. The outcome of an IVF cycle can go in different directions. A positive pregnancy test is the goal everyone hopes for. However, it is also possible that the cycle does not result in a pregnancy. This can be incredibly difficult and disappointing. It is important to remember that it is not your fault. Your fertility doctor will discuss the cycle with you, review what happened, and talk about potential next steps. This could mean trying another IVF cycle, possibly with some adjustments to the plan, or exploring other options. Whatever the outcome, support from your medical team, partner, friends, and family is essential as you navigate the path forward.